Good afternoon and welcome to another encounter here at Love Akron Live. I am your host today, Coach Kemp Boyd, Executive Director of Akron. And listen, if you haven't been outside, go outside after our episode today. I want you to stay for the episode, or maybe you're outside watching it, which is great, but it's just beautiful, man. This is great. I know probably last week, man, we had a lot of rain. There was a lot of wind. It was cold. It got chilly. But, man, it was just really great to wake up this morning, see the sun out, see the sun shining, and know that it's great to be with you today. I'm so excited about our encounter today. And notice I keep saying the word encounter because this is another one of our Encountering Pro platforms, if you will, to where we get to encounter different people who are making collective impact around Greater Akron. And today's guest list is no different from, man, the guest list we all have, which is incredible. And so just want to say today's encounter is really, we're focusing on community awareness, right? We have to make you more aware of what is happening and going on in our community so that other people know. And if you're out there watching today, man, thanks for being with us. I see my man up there, Ben Beaver. Shout out to Ben, man, the red bittered fiddler is like what I like to call him. I got tongue tied there, but man, it's great to see you on, brother. We're just really excited about what is happening and going on today. And so before we get into our guests, you know, we always got to have a spotlight that's coming on. And our spotlight guest, I haven't been with him in a while, but I know he's probably been on here a lot more than I have. And that is my man, my brother, my friend, Dr. Doug Smith from Summit County ADM board. And just to kind of give us, he's going to be giving us another update on what's happening, what's going on with COVID, but also what's going on with the vaccine as we continue to move down the line of, man, I don't know if I want to call it post-COVID or pre-vaccine time, but let's just all couple it together. Doctor, how are you doing this afternoon?
Doing very well. I agree. The sun makes it a lot better.
There you go. It makes it easy, right? It makes it easy to have a smile on your face, to have a positive attitude when you see that sun, for sure.
For sure. Yep. Thank you for having me back. So, yeah, I will try to give an overview. And as always, I'm willing to take questions, or people can reach me at the ADM board. Our main number, 330-762-3500, would just be the main number to call, and you could reach me that way if you had questions. So let me give you a quick, I'm going to start with the negative that unfortunately we can't say post-COVID yet. And then I'm going to move into the very much positive aspects of the vaccine and how things are moving. So this update actually just got updated yesterday. So that's the most recent that we have. So people just need to be aware that we have had over 1 million actual reported cases in Ohio of COVID-19. So that's people that actually got tested and it showed up as a positive. We've had over 57,000 people hospitalized. And of that whole group, about 19,000 have died. So that really is horrible. That's the negative news. We have been trending down in terms of cases reported within a 24-hour period. Unfortunately, actually, in the last 24 hours, I just read that we've bumped back up again. So we had been trending down, and we bumped back up in the last 24 hours. So we've had over 1,400 cases in Ohio reported just in the last 24 hours. So we really can't say it's gone yet. I don't think it's surprising to see it wax and wane a bit. But obviously, we'd like people to stay healthy and avoid getting COVID to start with, let alone avoid any long-term effects, because there are individuals who report longer-term effects of having had COVID. So where are we at with the vaccine? We've got over 4.2 million people in Ohio have been fully vaccinated. That's about 36%. We've got 4.9 million who've had at least one dose, meaning eventually they're going to all be fully vaccinated. So that's about 42%. In the United States, it's very similar to Ohio, about 116 million people. That's 35.5% have had a full vaccination regimen, and 153 million have had at least one dose. That's 46%. So Ohio is pretty well paralleling the United States right now, but the millions is important. I'm going to talk about that with the vaccine in a few moments here. So let me be clear that despite the fact that we're getting vaccinated, the people who are not getting vaccinated, the United States is identifying a new case of COVID every 2 seconds. So during Love Akron today, There will be a lot of people identified with COVID across the country. That's nationwide. It's a big country, but yeah, just to put that is our lowest rate since COVID started, since about a year ago. So well, actually not when it started, but when it kind of hit its stride. So just to put that in your mind, this is far from gone. It keeps happening. People are getting this nationwide. The good news is that the vaccines, any of the 3 vaccines, so Moderna, Pfizer, Johnson & Johnson, and I'll talk a little bit more about that in a minute because I know people had some concerns there. Any of them are showing pretty close to 100% effectiveness in keeping people from getting so ill that they end up in the hospital. But that's a pretty big measure. Now, I don't want to get sick for a week or 2 or 3, but on the other hand, I think the fear for myself and others has been ending up in the hospital or worse, ending up dying from COVID. So to say that you can get some treatment in advance to prevent you from ending up in the hospital or worse, in my book, is pretty strong. So I just want to be clear about the other thing is it's definitely showing good efficacy against the variants that are most common here in Ohio and the United States. So Ohio, for example, now, and the United States, the most common COVID that people are getting is actually the UK variant. So it's changed from the original COVID, this variant, minor changes in the spike proteins and so forth on the virus. So about 70%, just to use a round number, in Ohio are now that variant. So when we're talking COVID, it really has changed. Despite that, the people that are vaccinated are holding their own quite well. So please be aware of that. The COVID deaths, so despite that 1 every 2 seconds being identified, we are at the lowest level in 10 months. And May is right now on track to be the least deadly month of the pandemic since March of 2020. So that is awesome news. Yes. Better than the sun. That's awesome news. We've just got to keep pushing for this. Having said that, it's still about 600 deaths per day across the country. So 1 is too many. Whenever we talk about any of these horrible topics, whether it's opioid overdoses, death by suicide, or COVID deaths, 1 is too many, right? So we really need to all pull together. And I really feel, in my mind, I'm obviously a physician, so I can say this more strongly, that I feel like part of our own being a citizen is to get the vaccine to help us move toward herd immunity, as they call it, HERD, herd, like a herd of cattle, herd immunity, which is really is a technical term for making it really hard for the virus to have anybody to jump to. Because remember, the virus is basically a parasite. It's jumping from one person to the next person to the next person. That's how it survives. If we stop that, it will no longer transmit, and then we'll be in good shape. The other positive news is they've now tested the Pfizer vaccine, which was the first to get the emergency use authorization. They've now tested it and approved it for everybody age 12 and older. So there's going to be a big push to try to get our young folks, particularly adolescents, now vaccinated. Previously, that vaccine only went down to age 16. So there's a lot of people in our country that are in that 12, 13, 14, 15 age range. So that is one that's being pushed for. And second to that, which I think is really a powerful statement about how good these vaccines are from a prevention point of view, and also in terms of not having very many side effects, certainly not long-term side effects, is that Pfizer is now looking at the data, and the FDA may very well approve that vaccine as an official approval vaccine, no longer emergency use authorization, or EUA, as you'll see written out there. That's awesome. And so real quick recap. Vaccines, we have worked on vaccines since 1798. Vaccines are far from new. We've known about DNA, which you've probably all learned about somewhere in school, a little bit at least, even before 1953. 1953 is when we learned about the double helix configuration. And since that time, we've learned huge amounts. We've mapped the entire human genome. We've also been working on mRNA, messenger RNA, which is ultimately how the vaccines really work in general for decades, particularly Pfizer and Moderna. The vaccines, none of them can cause COVID. None of them contain the virus in there. It's not weakened or alive. It's not there at all. And the vaccines, none of them actually alter your DNA so you're not getting something that's somehow genetically modifying you and turning you into something that you're not. So to just be clear, this is really all about tricking our immune system, really is what we're doing. We're making the immune system believe we have COVID, even though we don't, and we don't get nearly as sick from the shots because of that. And then our body's immune system, and I'm partly a physician because I'm fascinated by the human body and the human mind, and our bodies are amazing as long as we work to keep them healthy. The vaccines trick us, our bodies, our immune system. We can't feel it, touch it, smell it, right? It's in there in our bodies to create the antibodies. So that then I'll use Coach Boyd and myself. If Pastor Boyd and I, if one of us has it, the other one doesn't, but we're a person who doesn't have it is vaccinated, and let's say it's me that transmits it to him and he's vaccinated, his body will immediately sense that and ramp up antibodies. And so even if he gets a little bit sick, it'll go away very quickly, which is why he doesn't end up in the hospital and doesn't end up dying, obviously the worst case scenario. So it's really very, very powerful. The other thing, just to talk about other vaccine myths, none of the vaccines will cause autism, because that's been bandied about for other, including flu and other shots. And there's no microchips. There's nothing suspicious. So let me go back to that millions and millions of Americans, and of course, worldwide, I don't know the exact numbers, it's somewhere in the neighborhood of 1 billion, I believe I saw now, have received one of these vaccines, often the 2 shots or the 1 shot if it's Johnson & Johnson, and they're watching for all side effects. They're not finding any in terms of long term. Yes, people do get a sore arm. Be prepared for that. Some people get that from a flu shot, or if you're older, from a Shingrix shot to prevent shingles and so forth. Sore arm, not suspect. Right? They're putting fluid into your muscle, and your muscle is going to react to that. You have nerve endings there. You're going to feel a little soreness for a day or 2 or 3. Minor in the scheme of things when you compare that to getting COVID and all those potential symptoms, including the long-term potential for that. And we talked before, there's a lot of monitoring that goes on at the national level, even at the state level, for these side effects. People are reporting them. They report them to their doctor. Obviously, the emergency departments are reporting cases that come in and so forth. And the net result is it's very rare. And they've been none that are race-related and none that are sex-related, other than you heard about 6 cases that caught the attention. Now, imagine that, millions of doses, 6 people, they caught it very quickly. They were all female, had a blood clotting issue that seemed to be related to the Johnson & Johnson vaccine. They pulled it off the market immediately. And once they analyzed it and figured out what was going on, they were able to put it back on the market because it's extremely rare. But so please rest assured, this is being watched like a hawk by many, many, many people, and we're not seeing problems. And now, if you were hesitant, we call there were early adopters who jumped right on it, just like technology. There's some people who will never buy the VHS, and now it's the DVD or the MP3. But the truth is, most people eventually do adopt new technology. I think the vaccine's the same way. If you've been one of the hesitant people, I fully understand there are a lot of issues for people out there, particularly people of color. Our science has not been good in terms of research with people of color. These vaccines, however, have been tested. Their studies were done on at least 10% of the population that did it were actually Black Americans, and even actually in other countries as well. And that's the best we've ever had in terms of tests. I mean, so we really have moved the needle. But now the test has been on over 100 million people, plus worldwide 1 billion people. Lots of people have been tested of all races, and we're not seeing a racial issue. And again, not a gender or sex issue, if you will, other than that minor thing that happened with Johnson & Johnson, which they've now said we're back in business. So please be aware of that. But finally, I'll just reiterate, if you get COVID, initially people have the cough, the joint pain, the chest pain, shortness of breath. It's not pleasant. Fevers and potentially even a lower mood, heart palpitations, brain fog, if you will, difficulty thinking clearly. Could even go into various other organ systems, your heart, your lungs, your kidneys, there's skin rashes. All of these things can occur. You can prevent all of that by getting a vaccine that is going to give you maybe some arm pain and swelling, maybe after the second shot, a little bit of fever, a little chills, some tiredness, a headache, which personally, when I got my second shot, I had about 12 hours of that. That was literally it. And like a light switch at 5 p.m., that next day, boom, it went away. So I'll give you my personal experience there. So you may get something, but it is nothing, I assure you, compared to people who have had symptomatic COVID. And then the other final positive thing is that now they're finding that as people are fully vaccinated, that means 2 weeks since your second shot, or 2 weeks after the one-shot series, which is not a series, of Johnson & Johnson, that's officially you're considered fully vaccinated because it takes 2 weeks for your body to make the antibodies, right? As we described sort of briefly. Once you've done that, you can now travel in the United States without getting tested. You don't have to quarantine if you discover you get exposed to somebody. Whereas if you aren't vaccinated, you've got to do all of that. You can go to indoor settings with fully vaccinated people without wearing a mask or staying 6 feet apart, right? So we're back to relative normalcy if you're always with people who are vaccinated. If you're with indoors with unvaccinated people, you can do that. They're recommending no more than people from a household do that. So we're trying to take extra caution just in case, because there are variants out there. So there's things there, outdoor activities, of course, without wearing a mask. So you can go to the metro parks on a day like today. I would highly recommend it, as Pastor Boyd did. Get out there and enjoy the weather after your work day here. And then you obviously, international travel, there are some issues there. Not that most of us are racing for that right now anyway, but international travel, yes, there's still concerns because there may be variants in other countries that we aren't yet aware of.
Yeah.
So I want to
get a question before we got to transition. Now, somebody asked the question, will we need a new vaccine each year?
Great question. So that is still under study. I will tell you that what they've been doing is following the initial group of people who were vaccinated. And as they watch them, they keep testing, do they still have antibodies, which we take as it will protect them. They are at least 6 months into this trial now. I think it might even be 8, but they've only published the 6 months. At 6 months, it's still very effective, which is great news. What will happen is they're going to watch this group of people, the original 75,000 or so, and if they continue to have a high level of antibodies, I suspect that will be true at least a year. It could be longer. Once we know when it starts to drop, they're going to say, yeah, we better get another shot. They'll probably call it a booster. And so it's possible that you will end up getting a shot every year, as will I. It would be 1. It wouldn't be 2 again. But I think that's still unclear. I will tell you, having had the side effects and so forth of the shot, I will be first in line if they tell me I need to get my shot this coming February, which for me is about a year after I was fully vaccinated, because it's still so much better, even if I have 12 hours of not feeling well, which may not happen that a year later anyway. But even if I have that, I would rather plan for that and not have to walk around with the fear. And as I said once before, the single biggest side effect of getting vaccinated is relief.
Yes.
So many people are walking around afraid, and I don't blame them. I mean, it's a scary thing. And if you've known anybody, which by now you probably do, who have actually had symptomatic COVID or worse, and I'm very sorry for people who have lost loved ones to COVID, and that's horrible. So I will just leave it there. At any other questions, and again, I'm available at ADM board if people have questions or were too shy to ask them in the big forum here. And thank you, Love Akron, again for letting me talk about this, trying to get the word out. My goal is always to help people stay healthy.
Well, hey, Dr. Smith, thank you so much for being on and being a spotlight guest with us today. And we always are a little bit wiser based on this interaction with you. So, hey, enjoy the sun. Have a great day. And thanks again for your work. Appreciate you, brother.
You too. Thank you.
So I want to transition really quickly. I mean, our next guest, I know she has some things that she want to inform us of. But what I also want to do is I want to tell you about Cleveland Clinic Akron General, man, and the gratefulness that they have with the GAR Foundation for its support in its current creation of the No COVID program. The No COVID program. The purpose of this program is to provide accurate and culturally appropriate COVID and vaccine related information and resources directly to neighborhoods disproportionately impacted by the pandemic through partnership of the adult health systems and neighborhood level organizations. And so one of those organizations that I want to talk about in Spotlight right now is a great organization here on the west side of Akron. Is going to be the Urban League. And so I want to bring on our next guest, Jennifer Ross, who is the Director of Diversity and Strategic Initiatives at the Urban League. Jennifer, good afternoon. How are you doing?
I am well. How are you?
I'm doing really, really well. And so got a couple of questions. Hopefully, you give me a second because I really want you to ask these questions because I think our audience wants to hear from the standpoint of the Urban League what this program is really doing and how has the pandemic really affected your population or your participants that you're working with at the Urban League. So here we go. What is the role of Akron General and how are you collaborating on this project as the Urban League?
So as the Urban League, we are responsible for collaborating, and thanks to No COVID, the GAR Foundation for the No COVID initiative, because we were able to get a grant to collaborate with with Akron General and other organizations across Summit County to really think about ways that we could support our community. Dr. Smith was so helpful in helping us better understand the importance of vaccinations and also that COVID is still alive and well. So through this initiative and through this grant, we were able to distribute PPE kits throughout the community. And so in March, we distributed close to 500. In April, we did 500. And so we're hoping this month, and we have 2 distributions coming up tomorrow and actually Friday, where we're going to give 500 PPE kits out to the community as well. And so that's not actually our kits, but they were very similar to that, where, we had Gojo who provided Perel supplies to us and Cleveland Clinic who gave us wonderful literature around the vaccination. So it's been great that we could get information out to the community around the vaccination and also provide them with supplies, PPE supplies as well.
Man, that's great. And how do you believe the Urban League, outside of what you all have done back in March, right, with giving out these packages and those type of things, how do you believe the Urban League has impacted the community members through this season of the pandemic? What else have you all been working on and doing really to make that impact?
I think the biggest thing that we've been doing is just going out, talking to the community, and working alongside other organizations. We are hosting a vaccination clinic next week, actually on May 20th, Thursday, from 2 to 7 p.m. So I think part of it is we have to be out in the forefront to allow individuals to see us as leaders, one, getting vaccinated, right? And also saying we're going to provide a space that's safe. We're collaborating with Access Point and the NAACP to bring folks in to say, hey, let's get vaccinated and bring your family in. So we've really been working closely with our community orgs, such as Helen Arnold and other organizations that's connected to the Urban League, as well as getting out in our community just to help them understand the importance of ways that we can ensure that we are, that we are using COVID measures to make sure that we're not, spreading germ, but also 2 ways that we can get vaccinated. And if not get vaccinated, just inform the community so that they can make an educated, informed decision as to why they want to get vaccinated or possibly not.
Dr. Ross, before you leave out, please tell us the date again of the program that you all are having.
So the vaccination clinic will be held on May 20th. That will be next Thursday from 2 p.m. to 7 p.m. in collaboration with Access Point and also the Akron NAACP.
Man, Dr. Ross, thank you so much. One of the things I love that you said is, hey, we're just going out and meeting our community members. We're going out meeting with them, but also the heart to want to collaborate and to do this approach from a collective impact perspective. Man, Dr. Ross, I just love that. And thank you so much for your time. I know this is like the second or third time we've had you on, but we value your insight and your input, but also we value the Urban League and what it means to our community. So thank you so much for being with us today and have a great afternoon.
Thank you. And we appreciate your platform because we know it's important that we can get out in front of folks to say, hey, this is what's going on. And this is the way we are collaborating with our, colleagues and community members across Summit County. So thank you for having us.
Man, thank you. Well, listen, it's just great information. So thankful for, man, Dr. Smith coming on and just sharing with us about updates on COVID-19, but also the vaccination update, but also Dr. Ross on what's going on at the Urban League and how they are impacting their community exactly where they are by meeting the residents exactly where they are. If that means getting out of my desk, going out and saying hello to them, this is what this is all about. So we're so excited. And I was able to talk just a little bit about the program that has happened, the No COVID program. That is, man, that the GRR Foundation, shout out to Christine Mayer and Brawlin Thurman. If you remember, we had them on a few months ago talking about the No COVID program that is going on. And here's the thing. Here's what I love about this. The beautiful thing about this is it's not just one organization that's heading it up or that's doing it. Man, it's a combination and a collective and a partnering, if you will, of several different organizations around Akron who are saying, hey, man, we want to be a part of this program and we want to be doing this together. And so one of those organizations is South Street Ministries. So South Street Ministries is canvassing South Akron and Summit Lake neighborhoods to distribute COVID kits and information. South Street Ministry is organizing a caravan event on May the 29th from 12 to 4 p.m. with Dr. Debbie Plate coming out to talk about the vaccine and answer any questions. Summit County Public Health will give vaccine on site too. Listen, this is huge stuff that is going on. We're going to put this information up, but instead of putting the information up right now, I want to bring on my next guest, Joe Tucker, who is, man, not just a friend of mine, but he's a brother of mine who, man, we got a really great relationship. Love this brother, man. He's doing a really great thing. Joe, you got to tell me, man, like I'm sitting here looking at this. You're organizing a caravan event on May the 29th from 12 to 4 p.m. First of all, where's this event going to be held at?
So we're doing it at 3 different sites. Like Jennifer said, we got to get out with the people. So from 12 to 1, we'll be at the corner of Grant Street and Cole, right in South Akron. Then literally we'll caravan. We'll get a big truck with doctors on it, a Metro bus, a Cleveland Clinic vehicle, and we'll drive over to Summit Lake. We'll be at the intersection of Princeton and Bechtel. We'll be there for an hour. Doctors will take questions about vaccinations. Summit County Public Health will provide vaccinations there and then. We'll distribute some food to get people there and some PPE supplies as well. And then we will finish up our caravan at, we'll make sure I get the name right, St. Ashworth Church of God in Christ over in Shabandi Hill. So really we're hitting up 3 neighborhoods, South Akron, Summit Lake, Shabandi Hill in 4 hours.
Wow, man, this is a huge undertaking, Joe. And
yeah, no
I want to say, I want to say personally, man, as a brother to you and as a friend, but also in an organization that is partnering with you, thank you so much for your willingness and wanting to get involved. And I know, Joe, I know you for a long time, man, so you've always been a community person. But talk to me about this, man. This is a serious, if you will, question I'm going to ask here. But knowing that there's a great deal of mistrust in the community of COVID, seen as a trusted voice in the Black community, how does this conversation start about trusting this COVID process, the vaccine? Like, how are you all leaning into that from your organization perspective, but also you just as an individual? And I know I can ask you this question, man, because I know your heart here, but also, I know what you're living in. I know where South Street Ministries is, right? Like it ain't,
yes, sir.
It ain't over in the suburb. You know what I mean? So how have you and your organization really leaned in as a trusted voice in our community, reaching out to the Black community when it comes to this?
Yeah, this is a great question. I've thought about this a lot for this time today, because you're asking about trust, and essentially you're asking about belief. Do we believe this stuff works? And I was thinking about it. I'm a person that I believe this cat named Jesus lived, then died, then 3 days later wasn't dead anymore. And I've based my life around that belief and the decisions I make. In a different form of belief, I believe the vaccine works. What the doctor said earlier today, like I take that to the bank and I make my decisions based upon those beliefs. Those beliefs are informed by science, and those first beliefs are informed by, faith and what I perceive as logic. But I live my life according to beliefs. So the chance to drop off COVID kits door to door, Not all the time. We've been pretty safe. We don't knock on the doors. We just drop them off. But I'd say 1 out of every 10 houses, someone opens that door and says, "Hey, what's going on? What are you guys up to?" This is a gift from the Cleveland Clinic, through the GAR Foundation for COVID information. And every single one of those kits has a flyer that addresses just what that doctor said: vaccine myth versus is that vaccine truth. And we're not professionals, so we'll share what we know. But more often than not, we'll listen. Hey, have you got it yet? Why not? What are you hesitant about? What are your reservations? Have you talked to your doctor about this? So, like the faith of Jesus I modeled my life after, I try and ask some good questions of anyone that has hesitancy, and I listen well. If they say it's a cultural hesitancy just based off what, as a Black person, they've gone through and understood, I listen to that. If it's a scientific hesitancy based off whatever they're reading on Facebook or whatnot, I listen. I don't try to argue, but I'll just continue asking questions.
I love that approach, man, because again, and I've said this a lot, but it's about meeting people where they are, and it's not being dismissive of their answer. It's listening to their answer and saying, okay, if they go this pathway, this is how I'm going to function and operate. If they go this pathway, this is how I'm going to function and operate. But here's what I'm not going to do is I'm not going to disrespect them by dismissing their answer. And so that's how we continue to build trust with one another. Man, love that answer. Tell me more about Dr. Debbie Plate's going to be coming out about the vaccine and answering questions. And then also it says here that Summit County Public Health will give vaccines on site. Tell me about that.
Yeah, that came together really quickly. I was excited for that. We wanted medical professionals to be available in the neighborhoods. I think the Love Akron Lives, I think the Zoom workshops and seminars have been fantastic. But at this point, we've reached the audiences we're going to reach through social media. For the vaccine hesitant, it's going to folks and just listening. And often it's bringing in folks like the doctor earlier today and Dr. Plate to really, field those questions on site. So we're going to do a couple of strategic invitations to get people out, some food, some giveaways, some goodies, some recognitions. But really, we want the main, presentation during that time to be, hey, if you have questions, ask them right now. We had a medical professional that's from the community to field your questions. Ask them. They're not going to bamboozle you. They're not going to disrespect you, but they're here in your neighborhood, in your intersections, to ask those questions of you. And if you're convinced or you just haven't been able to get it yet, Summit County Public Health will be on site to provide vaccinations as well. So really the Johnson & Johnson vaccines accessibility made that a possibility for us. And I'm really excited to just be able to roll that out.
Man, that's a great job. I want to give the date again. So South Street Ministry is organizing a caravan event on May the 29th from 12 p.m. to 4 p.m. And here's the thing, they're going to have vaccines on site. Like that's, again, meeting people exactly where they're at. And that's something that me and my brother Ben Beaver, we talked about all the time. How do we meet people where they are? And man, Joe, I just appreciate you doing that, man. Now listen, I know you do you have anything else to do? Can you hang around?
I'm here.
Oh man, listen, because I need somebody else with me, because our next guest, he's coming on, and his name is Austin Kirkland, and he is the program manager of community health and partnerships at Cleveland Clinic, Akron General. And I wanted Joe to stay on with me because I needed somebody else with me that didn't have a tie on. Like I couldn't be by myself. Like it's sharp, man. And you couldn't leave me by myself, Joe. So thank you for hanging on. Austin, man, I'm impressed with you, man. Like, brother, you look good, man. Thank you so much for being on with us, man. I haven't met you before this, but I'm so interested to talk to you about, man, tell us how do you think this program, this no COVID program, how is it going from a standpoint of Cleveland Clinic, Akron General?
Yeah, absolutely. So first, thank you for the question, Kemp, and thank you for the platform and to the GAR Foundation for allowing us and work on this project here. So really, Kemp, this project had a focus on community health and specifically COVID-19 pandemic and racial inequity. So Akron General has really been increasing its efforts to reach the communities and how that has been disproportionately affected by COVID-19 and some of those health disparities. So as healthcare providers, we know firsthand that systemic racism results in health disparities, and then which also can result in worsened outcomes, or even shorten life expectancies. So the coronavirus pandemic has really, I would say, underscored the grim facts. So it was important that we address the concerns of African Americans that are being disproportionately affected throughout this cause and throughout this pandemic, by also understanding some of those social conditions and some of those major determinants of health that the pandemic continues to bring to light as far as this issue. So as we thought about addressing some of those issues and disparities surrounding around the Akron general areas, some of the goals was to distribute COVID care kits with educational materials, and that, and Joe knows he's been awesome throughout this process with educational materials in partnership with South Street Ministries, Urban League, and Dr. Ross and her team, and you all, Kemp and Love Akron, who have been incredible in making this come to life and making this project really build. But also to that is to build trust. I heard Joe spoke on building trust with some of your doctors, some of your physicians, building that trust and awareness of the importance of some of your primary cares within your Center for Family and Medicine. But also to create some of that mental health awareness education, specifically targeted towards minority behavioral health groups. So it was very important that we address those issues and from a big scope and larger scope to really address how COVID and the vaccine and related information can be useful to not only our community members, but how it can impact them and how they can better their situation and circumstances.
Wow, that's a lot. One of the things I love about this is the fact that Cleveland Clinic Akron General didn't say, hey, let's jump on our horse and we're going to ride into these communities and we're going to come into these communities to do all those things, right? But I love the approach that was taken, was saying, no, let's identify some of those organizations within the community. Let's meet with them, let's talk to them, let's get their input before we go any further. So tell me a little bit, and I'm gonna go to you first, Joe. How did that engagement start with you? And I want to say Cleveland Clinic Akron General. How did that happen?
I mean, we have to thank the GAR Foundation for that. Really, Bronwyn Thurman is the hero of this story. She was one that, the GAR Foundation has never focused on health. That's not one of their primary funding venues. And with COVID, they had the conversations at a board and staff and leadership level to say, hey, this is the need. We have to respond. So Bronwyn Thurman made a bunch of phone calls and asked, how do we get this out in the community? There's inequity. There's some painful Black history around health and vaccinations. How do we engage this? She asked Cleveland Clinic. She asked South Street. She asked Urban League. She asked other partners, way more than I know. And from that, they were kind of the convener that said, let's work with the big hospital system, but let's also work from the ground up as well. So I can't take too much credit other than being the boots on the ground for what has been a GAR-led initiative to address inequity in health. So
Absolutely.
Forever grateful to Bronwyn Thurman for that one.
Hey, shout out to Bronwyn. Also, from your perspective, is this a great strategy as we talk about it? I want to continue this building trust theme. It seemed like this was a great strategy for you all as the big high-level organization or hospital right in our community to say, hey, let's find who's boots on the ground. And taking that approach, have you seen that taking that approach, has it been prosperous, if you will, for you all as a big major hospital to gain some of the information that you've been looking for?
Yeah, most definitely. So let's take it a step back here. So historically, minorities have had a mistrust of the healthcare system due to just decades of structural racism and misguided medical experiments. And for example, we can even say like the Tuskegee syphilis study, right? So according just to some of those recent studies at Kaiser Family Foundation, like 35% of African Americans were reluctant to receive the vaccine. And amongst the biggest concerns, 71% of those respondents was cautious of the side effects, and 50% was worried that they would actually get COVID-19. So as you think about how people are affected by this, it was important that we brought the awareness and also brought the misguided mistrust that is going on throughout our communities currently. And the biggest factor with that is within our healthcare system. So part of that was specifically with our primary care physicians is building that mistrust, but building the trust within the community. But also not along with building just that trust, but just the awareness and the importance of why it's very important to communicate and to go see your primary care physician. Because we all know with COVID being as a focal point right now, we want to be resourceful from a long-term standpoint, and that's culturally. So Cleveland Clinic Akron General was eager to get down to the ground and get to the neighborhoods and the communities and collaborate with South Street Ministry and Love Akron and our GAR Foundation. Because when we got this news of importance, this fall exactly from an alignment and from a goal, from a health perspective that we've been eager to get to for decades. So now that our primary care positions are in place and position, and for that communication, and now that we're hitting the groundworks, it's also important that the community understands that it's essential that your primary care physician, help you identify and help you manage. They're there. That's what they're there for. They're there to help you manage some of chronic disease and overall your health care. So when you think about potentially health problems later on, that can be prevented on your earlier stages and can be less severe as you continue to visit your primary care physicians.
Man, that's great. And I just want to sum up a little bit of what you said. It's going to be hard for us to build trust until we can acknowledge the distrust, right? And we can't build trust until we can acknowledge distrust and where that distrust came from. Man, just love that. Love what's happening. Love what's going on here. Just before you all step away, just kind of if you could just deliver any type of parting words of encouragement to our listeners, to our audience from the seats that you sit in, what would that be?
Austin, you want to go first?
I was gonna say, I didn't know if jump first or not.
Go ahead, Austin. Go ahead.
Yeah, absolutely. So the message I would give is please see your primary care physician. It's important to get those mental checks, health checks, so that way you can take care of yourself, take care of your health, which is very most important. We have vaccinations that are out there for the public at a lot of our community recreational centers, our community hospitals, our community partners. Please take advantage of this, please, because in order to improve our communities, we have to improve ourselves as well, too.
Man, awesome. Joe, parting words, brother.
Yeah, man, love your neighbor. I think this has been a neighborhood outreach. We've gotten to walk the neighborhood, just passing out COVID kits door to door. And part of that loving your neighbor process is listening to them and loving them, not being dismissive of any decisions or opinions they may have, but encouraging and love just day in and day out what that could look like for them. So asking those healthy and positive questions of, hey, have you talked to your primary care? What are your reservations? I love you regardless, but this is a community good we can move towards.
Awesome. Before we transition to my closing thoughts as Coach Kemp, I got one last question for you, Austin, and I'm a kind of observant guy, right? I pay attention to people I'm talking to. My last question for you is, what happened in 1906? I don't know that, the date I relate to is 1914, but that's just me. That's a date that's near and dear to my heart.
That's when the greatest organization in the world was born.
Hey, man, listen, appreciate you, man. Appreciate you, Austin, man. I look forward to connecting with you soon down the road. Joe, man, love you, brother. And thank you both for being on with us today and just sharing your heart, but also the importance of the No COVID program and all the events that are lining up to go with that. Thank you, brother, so much, and have a great afternoon.
Thanks, Cap. See ya.
All right.
Take care.
See you, Austin.
Man, hey, listen, there you have it. I told you guys we're going to have a good time today. We're going to laugh. We laughed. gained more wisdom, knowledge, and understanding, which is really great. And also we got to meet some really great organizations, but also individuals within those organizations that are doing really, really great work. And so I would be remiss if I didn't send a shout out to, the GAR Foundation for entrusting us to be a part of the No COVID program. Thank you so much, GAR. And also, big shout out to Cleveland Clinic Akron General for wanting and having a desire to kind of get down on the grassroots level, but not to do it themselves, but to connect with organizations within these communities that are trusted organizations in the communities to help lead this charge. So I'm really excited about that. I'm excited about everything that's going on across Greater Akron. Not that everything is perfect, but again, it's just about perspective. And I love what Joe said there at the end, man, just love your neighbor. At the end of the day, this is about love, and this is about us going from being a noun to a verb. And the way that we do that is just simply through the concept and the aspect of just loving our neighbors greatly and dearly. And so big shout out to our production team behind the scenes. You don't see them, but I do, because they're constantly keeping us on track. That is Excellence Marketing with Sharina George and Joe behind the scenes doing their thing. Thank you all so much for making me and making all of us look really good. And our platform looks great. Thank you so much as the audience for being with us today and taking time out to listen, to learn, but also so we can lead together in Greater Akron, so we can make really, really great things happen. And so, always before I go, I say one thing, but I also want to remind you, for us to be able to do what we do, we invest a lot of time, we invest a lot of talent, and we invest a lot of treasure in this, because we think it's important to serve Greater Akron in this way of helping to raise the awareness of what is happening and going on. And if you would like to be a part of Team Love Akron, there's a very great, easy, and simple way for you to do it. And you can join our Love Akron 50 by 50 team. Notice I didn't say Coach Kemp 50 by 50 team. This is why I switched that up. Is because here's the bottom line. I don't know how long God is going to have me in this position, and hopefully he don't call me home too soon. But however, this is not about Coach Kemp. This is about you, and this is about an organization. And this is about how Love Akron, the mission, the vision, the purpose of it is going to last and carry on a lot longer beyond me. And so if you would like to be a contributor, a giver to this noun to verb movement, you can join the Love Akron 50 by 50 team by going to our website at www.loveakron.org. Click on the Give tab and scroll down to 50 by 50, and you can be a recurring giver. What is 50 by 50? It's simply 50 people giving $50 a month so that we can continue to do the things that we're doing to Love Akron, but also it's a way for you to partner with us in how we do this, from going from being a noun to a verb. And we're also going to have a 50 by 50 team for individuals, for churches, and also for organizations. So stay tuned for that. And remember, if you don't do anything else today, make sure that you what? That you love Akron. Just love Akron. As Joe said, just love your neighbor. Hey, thank you so much for being with us. Remember, you can catch us the first, the second, and the fourth Wednesdays of the month right here on Love Akron Live. Thank you so much for being with us, and we look forward to seeing you soon. Take care, and God bless.